Welcome. In this explainer, we're going to break down a condition called Lynch syndrome. Our goal here is pretty simple, to give patients and their families the information you need to understand what this diagnosis means and what comes next. Have you ever asked yourself that question? This is for anyone who's ever wondered about that, but it's especially for you if you or someone you love has been diagnosed with colorectal cancer. Okay, let's dive right in. All right, first things first. What exactly is Lynch syndrome? To put it simply, Lynch syndrome is a genetic condition that gets passed down in families. It doesn't mean you're definitely going to get cancer, not at all, but it does mean your risk is higher than the average person's, and that is really important information to have. Now, let's put this into perspective. While it is the most common type of hereditary colorectal cancer, it's only found in about 3% of all colorectal cancer cases. So it's a really key piece of the puzzle, but it's not the whole picture. So to really get how this all works, it helps to use a little analogy. Imagine your body is constantly, and I mean constantly, making copies of a super important document. And that document is your DNA. Every single time a cell divides, it has to copy that entire genetic instruction manual perfectly. To make sure those copies are perfect, your body has this amazing built-in spell checker. It's called the mismatch repair system, or just MMR for short. Think of it as a team of genes whose only job is to proofread the new DNA, find any little typos, and fix them right on the spot. It's what keeps our genetic code stable. And right here, this is the key. In Lynch syndrome, one of those spell checker genes has a glitch. It isn't working at full strength, so it misses some of the typos. A few little errors slip through the cracks. And over many years, these tiny, uncorrected errors start to pile up. And that buildup is what can eventually lead to the uncontrolled cell growth that we call cancer. Okay, so if this is all happening at a totally microscopic level, how in the world did doctors actually figure out someone has it? Let's walk through that. Well, there's actually a very clear logical process. It usually kicks off right after a cancer diagnosis. First, doctors test the tumor tissue itself. If it shows signs that the spell checker system, that MMR system, wasn't working right, that's a huge clue. That clue then leads to genetic counseling to talk about family history, and finally, a simple blood or saliva test to find that specific faulty gene. That's what gives you the definitive answer. This is so important that current guidelines now recommend that every single person, literally everyone, who is diagnosed with colorectal cancer should have their tumor tested for these signs. This is called universal screening, and it's a huge deal because it ensures we don't miss cases. And that's vital, not just for the patient, but for their whole family who might also carry the gene. Getting a diagnosis like this, it can feel really overwhelming. I get that. But here's what it really means for you. It's not about fate, it's about knowledge. And as they say, knowledge is power. This part is so critical to understand. Think of it less like a crystal ball that tells you your future and more like a highly detailed roadmap. It just shows you which parts of your health need a little more attention so you and your doctors can navigate the road ahead and be proactive. So what does that roadmap show us? Well, it points to a few specific health risks to keep a close eye on. The risk is highest for colorectal cancer, for sure. But for women, the risk of endometrial or uterine cancer is also way up there. It's the second most common cancer we see with Lynch. And then there are these other cancers on the list. They're less common, but still really important to be aware of. And this is where that knowledge becomes your most powerful tool. Because you have this diagnosis, you and your medical team can build a totally personalized, proactive health plan that's all about one thing: prevention and early detection. Just take a look at the difference here. It's pretty dramatic, right? For most people, colonoscopies start around age 45, and you do them every 10 years. But with Lynch syndrome, whoa, you start way earlier, like in your early 20s, and you do them every 1 to 2 years. The whole point of being this aggressive is to find and remove any little polyps long before they ever have a chance to turn into cancer. And if you're wondering, does all that extra screening really make a difference? The answer is a huge, resounding yes. I mean, look at this. Research shows that sticking to this intensive screening schedule can add, on average, 7 years to a person's life. It is one of the most effective things you can do. And the proactive plan doesn't just stop with the colon. It's a whole body, comprehensive approach. For women, it includes regular screening for endometrial and ovarian cancers. Your doctor might also recommend checkups for your stomach and urinary system. And get this, even something as simple as a daily low-dose aspirin has been shown to help lower the cancer risk. Now, let's say a cancer does develop. Well, guess what? Knowing you have Lynch syndrome can be a huge advantage in guiding the treatment decisions you and your doctor make together. For colon cancer, there's a big decision on the table. A surgeon can do the standard thing and just remove the part of the colon that has the tumor. Or, because the risk of a new, separate cancer popping up later is so high with Lynch, they might recommend removing the entire colon. It's a really important conversation to have, all about balancing the risk of a future cancer against the quality of life impact. And here's some incredibly good news. That genetic glitch, the broken spell checker that causes Lynch syndrome, it turns out it also leaves a special signature on the cancer cells that makes them look really weird to your immune system. And that means they are often incredibly vulnerable to modern immunotherapy drugs. These treatments basically take the brakes off your own immune system and let it attack the cancer. It's a really powerful and targeted new approach. So, if you take one thing away from all of this, let it be this. A Lynch syndrome diagnosis is not a destination. It's a roadmap. It gives you the power of knowledge, it tells you which roads to watch, what precautions to take, and it empowers you to be the driver of your own health for a long, long time to come. So this knowledge, it completely changes the conversation you can have with your doctors, whether it's about your own health or your family's risk or just understanding your screening plan. The whole journey forward starts by asking questions. So take this information and go start that conversation.